Good evening, and welcome to Investigate This on Al Jazeera. Officials are warning of a looming health crisis in the Middle East and Africa after increasing rejection of psychiatric drugs. A group allied with the Association of Traditional and Faith-Based Healers claimed in a statement that psychiatric drugs to treat schizophrenia and other serious mental disorders are, quote, tools of the West to control the minds of our people. Traditional practitioners across the world are following suit. Their support is strongest in refugee camps, where millions of displaced lie in wait without access to any care beyond the most basic physical needs. Something clearly must be done. The MonWHO conference begins in Montreal this week, where international stakeholders will meet to find remedies to this crisis. Joining us is Major Dr. Jamal Al-Moon, an eminent expert in refugee law and public health. He joins me from Cairo. Welcome to the program, Mr. Al-Moon.
Thanks for having me. Sorry I'm late, my taxi didn't turn up. As you can see, I've lost my Major Doctor hat.
Now please tell us, from what you can gather, why are these drugs being rejected by the population en masse?
To understand why, we need to put things in context. European governments have become largely indifferent to the healthcare needs of non-citizens. Across the West, even as far away as Canada, the right of refugees to access adequate healthcare is under threat. In failing states like Sudan and Yemen, there simply isn't enough funding. So people need something else to turn to, and they've chosen traditional healing, which in many cases is far more widely available. And of course, in the absence of proper education, misinformation spreads much more easily.
Now, what would possess a group of people to take such extraordinary measures?
Well, I'm not an expert in geopolitics, but it was quite clear during a study on displaced persons we completed recently that there's a lot of issues with the delivery of basic mental health care, let alone treatment for severe mental illness. And schizophrenia, I must emphasize, is a very serious disease, and the WHO considers antipsychotic drugs used in its treatment essential to a basic healthcare system. But we're dealing with very powerful medications here. Patients' prognoses can worsen quickly. If patients think that drugs control their mind and refuse to take them, they're likely to think that mind control agents are everywhere.
Detractors are saying that the treatment is worse than the disease in many cases. Is there research to back this up?
That's certainly a very pithy way to phrase it, sir, but not exactly. We know that these drugs must be combined with regular follow-up care to be effective. One conclusion of my recent research is social supports are absolutely crucial. To provide that, patients need people from their own culture that can understand and empathize. That's the biggest contributor to these outcomes.
Major Dr. Jamal Al-Moon of Cairo University, thanks for being with us. Please follow our Twitter at Al Jazeera MTL 2015 and YouTube at youtube.com/MonWHO Media as we provide round-the-clock coverage at the MonWHO conference, March 20th to 22nd.